Pamela Murray. I'm an HR business partner and I work for Providence Healthcare.
I'm Toni Decaro. I am a manager for our Centralized Staffing department with Providence Medical Group.
Providence Healthcare is the Eastern Washington service area for Providence Health and Services. It's a not-for-profit Catholic healthcare ministry. It's committed to providing for the needs of the community. It serves especially for those of the poor and vulnerable. We serve a large regional area, which includes Stevens County, several rural areas and surrounding states. In Eastern Washington, our nationally recognized facilities would be Providence Sacred Heart Medical Center, Sacred Heart Children's Hospital, Providence Holy Family, Providence St. Joseph Hospital, Providence Mount Carmel Hospital, and Providence St. Luke's. It's a full continuum of diverse services. We really provide services from pre-birth to end of life. We also have more than 9,000 caregivers in Eastern Washington that live out our values of compassion, dignity, justice, excellence, and integrity in providing care for all. As one of the largest employers in the Inland Northwest, we do pride ourselves in being a great place to work. Absolutely. Healthcare is projected to grow by the U.S. Bureau of Labor and Statistics by about 15%. So that's about 2.4 million jobs in the next 10 years. And that's mainly due to our aging population, therefore creating a demand in our healthcare services. So yes, lots of growth in the future.
So we look for people who are aligned with our mission and want to help take care of the poor and vulnerable. We also look for people who are driven and self-motivated, and then people who are compassionate and reliable, because as a medical assistant, you're going to be working with these patients a lot and building that one-on-one relationship with those patients and earning their trust is a huge part of the job. And we're also looking for people that are adaptable and problem solving, especially now with how healthcare is growing, and to meet the demand, we're always looking for how can we make things better and adapt to the new environment.
First of all, it's an incredible opportunity to work in the healthcare industry. It provides not only, you're making a difference in our community, but it provides you a lot of opportunity to continue to grow in your career. So you may come in as a medical assistant, see that you love the work of an RN, go back to school with tuition reimbursement, be an RN, and even progress into a provider. Or you could say, gosh, love being a medical assistant, and I'd also love to see, if there's work in administration and work up through as a practice manager to a director, all the way up to a COO. So the career growth potential is pretty impressive in the healthcare industry. Great thing about working for a medical assistant, as a medical assistant in the healthcare industry, is that they typically are Monday through Friday jobs. They are not in the acute care system, so there's not a demand for night shift. And one thing specific to Providence and medical assistants is we do offer a career ladder. So it allows our medical assistants to start in as an MA1 or MA2. They can take on additional tasks, projects, initiatives, leadership opportunities, and those opportunities will bring on more earning potential and higher titles. So a lot of room for growth.
We like to hire students from Carrington because they are coming out of school and they know the basic skills for a medical assistant, so they're able to jump in and learn quickly in the clinics. They're also have a positive attitude and that compassion we're looking for to build that relationship with the patients as well as the other caregivers in the clinic. And we've been creating a great partnership with Carrington throughout the years to make sure their students are successful in their externship as well as when they continue out into their career. We have 2 managers right now that started out at Carrington College and then joined Providence as a medical assistant and then moved up into a lead position and then into a supervisor of the clinic, and now they are managers in running primary care practices We also have medical assistants that have come out from Carrington that have went on and become RNs with Providence, and also ones that have become physicians into the Providence community.
It's important to understand the company that you're applying to. So upon submission of your application, really take a look at, the company's mission, its core values, and if that resonates with you. Another really important thing is, when you're doing your externships, that's not only a time for you to get to see, gosh, this is where I might want to work, but it's also time for the students to put their best foot forward. So those clinic managers are evaluating their externs, not only based on their competencies and their skills, but are they going to be a fit for their clinic? So, really making your best first impressions as you're doing your externship, because those managers are looking and wanting to make sure that they hire the best, and typically those are Carrington students.